Hello, listeners. Welcome to Views on Health. Tonight on the program, it's Dr. Shania Gunasekera, consultant neurologist at the Institute of Neurology, National Hospital of Sri Lanka. Welcome back to our studios, Doctor. Pleasure to have you with us once again.
Thank you very much for having me here.
And after sleep neurology, which was the topic last time around, tonight it's going to be hypersomnolence. Hyper is excessive, as we know. So we say somebody's hyper when they are overactive. This is hypersomnolence. And according to Dr. Shania Gunasekera, it's excessive sleep. The microphone is yours, doctor.
Yes. So, just as lack of sleep, of course, which is the biggest problem among many people, having too much of anything is not good, right? So having too much of sleep, being too much sleep in the daytime is also a big issue for many people. So that is not just interfering with their day-to-day activities, that might be having a problem on their occupations as well. So just talking about hypersomnolence or excessive sleepiness, of course, multitudes of causes are there, but we'll touch upon the commonest one today. So first of all, if I give you the definition of hypersomnolence, so many of you might feel excessively sleepy in the daytime, but that might not be interfering with your daily activities. So if you are so sleepy in the daytime that it is interfering with your life, with your occupation, and with your daily activities, and then of course we call it a disorder, or we call it a hypersomnolence disorder. So it is actually a disease. So in that case, we must look into that because treatment is available. Treatment is available in many forms. It might be not just taking several medications, but there are many other things that you can do to keep you stay awake.
So, doctor, would you say that this is A, common, and B, that it's particular to any age group?
Yes, actually, even though lack of sleep might be more common among elderly, hypersomnolence is there, starting from childhood all the way to the elderly, the elderly group, because it of course is something which is due to many reasons. Therefore, we cannot really point out to a particular age group who are more vulnerable to hypersomnolence. So, of course, it is, rampant among all the age groups, yes.
So, when you see patients, what do they come and tell you? Obviously, they say they feel sleepy all the time. So, I would think that depending on their age, their gender, the type of lives they lead, you got to do your diagnosis and take it from there. So, what do you see? What is the common denominator here? Is there a common denominator? The other way about, that brings about hypersomnolence?
Yes. So when a patient comes to me and say that they are excessively sleepy in the daytime, so we always check into their nighttime, their sleep hygiene. Because most of the time, the reason as to why they are excessively sleepy in the daytime is they don't get a good quality sleep for adequate number of hours. So that is the main reason. So, of course, if I could elicit that from the patient and, address that, for most of the time, the daytime hypersomnolence can be abated. But there are some people, despite having a good quality sleep of good quantity, they continue to have excessive sleepiness in the daytime. Of course, that is, problematic. There, of course, I have to look into some kind of a neurological disorder. And proper investigations must be undertaken, and treatment will have to be instigated in such situations.
So it is a neurological disorder, no two words about it.
Well, not really. It is, most of the causes are not neurology related, because the sleep is a part and parcel of your brain activities. So I think I have discussed about the biological clock in our brain, and then the circadian rhythm, or the kind of the rhythm that our body is functioning to. So basically everything is related to the brain, but sleep, of course, is affected not only by the brain, but many other factors in our body. For example, there are conditions which I will touch upon with some more details in the future. Even disordered breathing at night with a lot of snoring. So even problems related to your throat, your ears, throat, and nose and all these can be contributory to hypersomnolence in the daytime. So it's not 100% related to the brain, but it eventually ends up in the brain. But it's something very multifactorial.
A question, I don't know how we're going to answer this,
Yeah.
doctor. Snoring. Now, if you take a couple and invariably the husband is snoring or the man is snoring, and then that can disturb the sleep of the partner. Now, in that situation, he is sleeping to whatever extent. I wouldn't say soundly, he may also wake up and go back to sleep, but the person next to him cannot sleep. How does that work?
Yeah, so that's what we call external factors. So external factors might be due to, as you said, some, disruptive sounds from your spouse or from the surrounding, and then, the lighting. So what they recommend is now actually the surrounding should be as dark as possible for you to have a good sleep. So coming back, always we are coming back to the biological clock. So the brain must identify that it is the night and it is time for you to sleep, not to wake up and walk around. So that signal should go to your brain from your environment, right? So if the wife in your story keeps on listening to the snoring sound of the husband, or in other words, if the room is very much enlightened, then of course her sleep is obviously disrupted, which will cause hypersomnolence on the following day. So it goes as a vicious cycle.
Interesting, yes. And then how do you address this situation?
Such a situation, of course, should be addressed not by any medications or any hi-fi stuff, simply by counseling and making the necessary environmental modifications. So, of course, we might have to address the snoring issue of the husband by any means. There are so many means to mitigate the snoring problems. And at the same time, if worse comes to worse, perhaps she might have to, maybe wear some headphones or sleep in a separate room for a short period until she, establishes her sleep cycles well. And then other factors like the lighting in the room and other external factors which are interfering with her sleep should be addressed. So once everything is addressed properly, she is bound to get a good sleep at night with a very fresh morning on the following day.
The next question, doctor, is that can this situation, you said from birth onward it can happen. So when they're small, how do you do this? Because they have to go to school, they may have some other activities in the afternoon, and they're small, and then they may not realize the need that they have to keep up, and they fall asleep. So that impacts on whatever they are doing. And then if they don't get the sleep they need in the night, and then which leads to this situation in the day, how does that work? Do you put them under medication?
Not really. Medication is always not the very first option in hand. So excessive sleepiness in the daytime is a very common complaint, mainly by the parents, because they find their children falling asleep in their classroom and they tend to miss their homework because of excessive sleepiness. So as I told you before, their sleep hygiene must be addressed. And at the same time, when it comes to children, their brains are still developing. So they are growing. So they can be easily trained. That is where this concept of sleep training come into play. So a sleep routine should be established from the day one of our life. So when a baby is born, I told you before that their biological clock is not set because they don't know the night, they don't know the day. So what is recommended is from day one, you can slowly start training them. You can slowly start setting their biological clock up. For example, for a little baby, they say in the daytime, expose the baby to the sunlight so that the baby identifies, all right, this is the daytime. And then slowly towards the evening, perhaps from 6 p.m. onwards, you can slowly draw the curtains and make the room dark, turn off the lights, and then give the signal to the baby, right, this is the night time. So the baby will slowly get herself trained to sleep in the night, to have a good overnight sleep, and then have a active daytime period where, the baby can get involved in a lot of activities. The same applies to school going children. They should go to sleep, let's say about 8 o'clock at night, and then they should be prepared to go to sleep. For example, having a wash around 7 p.m. and then, just reading some bedtime stories and all, just to calm down their active brains. And then at a fixed time they go to bed, and at a fixed time they wake up on the following day morning. So once the routines are set, they become established, and their sleep patterns become very well established, and most of these sleep related problems might not come into light. But I also must mention that naps are extremely important for children and also for babies, because I told you they are growing, their brains are growing, their neural connections are being formed in the brain, and their bodies are growing. So their bodies are being repaired all the time. So all these growth, repairs, and the consolidation of their memories, formation of new neural networks, all these things are happening mostly during the sleep. So actually, they need longer sleep hours than adults. So adults, the recommended sleep hours are 6 to 8 hours at night and 1 hour nap in the daytime. But for children, it is much longer. So actually, the recommended sleep hours are changing from age group to age group, but roughly they recommend 10 to 12, for a school-going child. So, and also a nap in the evening, because they need enough and more time for their bodies, their brains to repair and to grow.
But then if you take excessive sleep again, how do they get over it finally? I mean, it can't happen overnight.
Yes.
It takes time. And then in that time, how do you guide them?
That's right. So
to get into this, to get over it rather?
Yeah.
And then get into a normal pattern.
That's right. So as you said, it will take some time. It will need a lot of dedication from the child. And if you just generalize it to the children and the adults, it will definitely take some time. It might be really challenging to the patient and also to the family members. So they really needs a lot of support. So since I'm an adult neurologist, I would like to concentrate more on adults. So until they regularize their sleep, of course, sleep training is very important. That means training them to have a good night's sleep, as I told you before, going to sleep at a set time, waking up in the morning at a set time, maintaining a good sleep hygiene and reducing screen time, doing a lot of exercises in the daytime, having nutritious meals with a lot of water. All these have an impact on your sleep. And then you have to minimize taking certain substances like alcohol and all. So all these should be addressed. Until such time, there are instances where we use certain medications to maintain the wakefulness during daytime, right? So that, of course, should be prescribed by a neurologist or a psychiatrist. It should never be taken by the patient himself, because those medications, of course, what we call it psychostimulants, or maybe to keep your brain awake until your sleep routines are established. So once your sleep routines are established, once your daytime sleepiness has abated, we can slowly take off those medications. The medications are not the answer. It's just an aid until you reach your targets.
So doctor, if a patient has this condition, can he or she, for example, you spoke of the psychiatric side of it, so there can be issues, actually go into some other area? Will it lead to something else?
Of course.
Where health is concerned.
Yes. So suppose a patient comes and tell you that the patient's sleep hygiene is extremely good, right? So they basically gets a good night's sleep, a quality sleep, they sleep for 8 hours, but still they complain that they have daytime hypersomnolence or sleepiness. At that point, we should look into other causes. I think I would like to take this opportunity to increase the awareness about 2 important diseases to our listeners. That is, first one is obstructive sleep apnea. Even though the word might sound a little complicated, this is something very, very common, right? So, second one is narcolepsy. Again, those two I want to educate the public about these 2 conditions. Obstructive sleep apnea is a condition when a person is overweight and when the person is sleeping upright, the jaw muscles, the jaw fat, the big tongue, and all can block the throat. Therefore, the breathing is hindered for some time. Therefore, you might hear it as snoring and sudden cessation of breathing. The patient just stop breathing and suddenly start breathing like that. So there are some obstruction to your sleep, obstructions to breathing, which can hinder the quality of your sleep. So apparently, this is something extremely common because obesity and overweightness is a major issue in our country with the current food habit and inactivity. So this is a big issue. So what is so serious about obstructive sleep apnea is this obstruction to breathing can cause reduced oxygen levels in your body. In turn, this can lead to many other health hazards starting from high blood pressure, heart attacks, strokes, diabetes, and many other problems can be the outcome of obstructive sleep apnea. So always, if somebody, particularly an overweight person, say that I'm excessively sleepy in the daytime, we have to ask the patient whether he snores a lot at night, whether there are episodes where he stops breathing suddenly and start breathing again, if he has high blood pressure, high sugars, and history of heart attacks and all. We have to address this obstructive sleep apnea, this big problem, because if we can address this, we can prevent the concomitant health hazards. The second thing is narcolepsy. It might be a very new topic to Sri Lankans, but it is something very common in US and other Western countries. Narcolepsy, of course, is a condition where you are genetically predisposed to have excessive sleepiness. Therefore, particularly children, they are excessively sleepy in the daytime. They cannot read a book. They cannot just sit and talk to somebody. They cannot just sit in a waiting area and, wait for their turn. They cannot just sit on the passenger seat. They cannot just maintain a conversation. They simply just fall asleep. And narcolepsy people also experience a very funny kind of symptom, that is, they suddenly go into sleep and just drop down. Yeah. So even though this might sound very odd to you, this is not something really uncommon. We have a lot of narcolepsy patients in our National Institute of Neurology, National Hospital of Sri Lanka, and also at Lady Ridgeway Hospital. But this is under-recognized. They always think my child is sleepy and he is not performing well in his education and he is sometimes dropping down. Probably these are fits and all, but the term narcolepsy might not come into their mind. But this is a very well treatable condition if this came into light. So I think this is a good opportunity for me to educate the listeners about these two conditions, which are not very uncommon as we think it is. And I think these two topics are, they are very extensive topics by themselves. So I might not be able to cover everything within the time allocated. So we might have to, discuss about these two important conditions at length in a future program.
Thank you. That will be wonderful, Doctor. So we can look forward to having you back on the program to discuss these two very important topics, like you said, narcolepsy, and also the
obstructive
sleep apnea.
That's right, yes.
Topics. Thank you, Doctor. So focusing on hypersomnolence or excessive sleep, what more can you tell us to inform our listeners about this condition?
Yes. So I've been going through the potential causes for hypersomnolence and a few other, if I may mention here, that is substance abuse. Because now we know alcohol and certain substances, of course, they might be causing the patient to go into drowsiness very soon. But in the long run, we have come across patients who have been kind of addicted to certain substances like alcohol, which is actually interfering with the quality of their night sleep, therefore causing excessive sleepiness on the following day. So when we ask them, they say, of course, I sleep well at night. But, even though they feel they are asleep, they don't get a good quality sleep as far as the brain is concerned. Because, they are like those substances might be kind of interfering them going through the normal stages of sleep. So that's another problem which is causing daytime sleepiness.
That's interesting, doctor, but because see, from a lay perspective, we think, oh, he is drunk, he has had too much to drink rather, and then he's going to sleep it off. But medically, you don't think he's getting the sleep he needs, the proper sleep he needs.
That's right. Actually, it's a vicious cycle because sometimes when people who are extremely busy and all, who have anxious personalities, they tend to consume alcohol to make it easy for them to fall asleep. In the short term, of course, it might be helping them to fall asleep because alcohol, of course, may be having some sedative effect on their brains and help to, mitigate their anxiety and fall asleep. But of course, in the long run, your brain gets addicted to alcohol and then the brain develops tolerance to alcohol, meaning to get the same feeling, they might need higher portions of alcohol in the future. Therefore, your brain gets so much addicted and so much, so much used to the quantity of alcohol they are taking, the brain might be craving for it to fall asleep. Hence, in the future, they might need to take some alcohol to fall asleep in the first place, right? So they will keep on increasing the amount of alcohol they are consuming until to a point where they are completely dependent on that. And our sleep is something very, very complicated. We go through different stages of sleep. There's something called REM sleep, non-REM sleep, and then there are stages starting from the most superficial of your sleep, and then you are going to the deeper part of your sleep, right? So these are called sleep cycles. These are well-regulated things in our brain. But when there's a substance playing around with the chemicals in our brain, we really don't go through these different stages of sleep very nicely. Therefore, a good quality sleep means a healthy sleep where the sleep is normal. You are going through these sleep cycles very normally, very smoothly. But when it is disrupted, even though you feel that you had a sleep, you might feel extremely unrefreshed in the morning. You will be having sleep fatigue. You might be having mental clouding. Yet you had a good sleep at night, but your sleep had not been healthy enough. And then it's a vicious cycle. Then you are feeling tired, you are feeling, very fatigued, and then you again consume a little bit of more alcohol to get rid of that. And it goes on and on like a vicious cycle. And of course, it comes to a level when it's very difficult to kind of regularize everything.
So, doctor, the withdrawal of alcohol in this situation, what you just explained, will that help total withdrawal?
Yes, total withdrawal
Suddenly it happens.
That, of course, sudden withdrawal must be handled very, very carefully under the supervision of a professional, may that be a neurologist or particularly a psychiatrist, because stopping alcohol altogether abruptly can deprive your brain of something the brain is dependent on to fall asleep. And the brain might, be on fire when the brain doesn't get what it wants. Therefore, it should be done extremely cautiously with the help of a professional. And there are some pharmacological medications as well, which might be helping the person over the course. So it should be done really carefully, never abruptly. Because sometimes these withdrawal can be extremely intolerable to the patient, and the sleep cycle, the circadian rhythm will be completely jeopardized if you try to stop alcohol abruptly. But it has to be stopped slowly, and the person should be completely abstinent from alcohol to achieve a good sleep and a healthy circadian rhythm.
Interesting, doctor. So time is catching up with us. What more have you got to add to this interesting topic of hypersomnolence?
Yes. So finally, I must say that hypersomnolence will be a disorder only if it will disrupt your life. Even if it is not disrupting your life, we can't call it a disorder. But if at any point you feel that I'm sleeping too much and it is interfering with my occupation, with my family life, and if it is interfering with all your work in the daytime, I think it's high time that you meet a professional. I must mention that at National Hospital of Sri Lanka, we have established a sleep neurology clinic which is happening on every Tuesday morning. And at the same time, there are many other places, starting from the psychiatrist, the neurologist, whoever that is. You must seek professional help because hypersomnolence is a big problem. So it might not be a problem until you identify that, but once it is identified, it can be addressed and treated.
Thank you, Doctor. On that note of solid advice, we end this very interesting discussion on hypersomnolence, which means excessive sleep. Thank you to you, Dr. Shania Gunasekera, consultant neurologist at the National Institute of Neurology, National Hospital Sri Lanka, for being with us on the program and sharing your expert knowledge on this very vital topic. Thank you, Doctor.
Thank you very much.
Thank you too to Prabha Veerasurya for technical assistance. I'm Fatima Razi Kada saying good night and hoping to catch you next Monday same time on Views on Health.